Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Bring another really awesome guest today involved in creating a better tomorrow. Today, we have the honor of being joined by Dr. Heather Ikemire, who is Executive Director of Lifetime Arts. This is a national service organization that's focused on accelerating the impact of creating aging programs nationwide and leading this national multi-sector movement, ultimately established these creative aging programs as drivers of older adult health and well-being. And the vision of the organization is ultimately to imagine a world without ageism, without social isolation, and ultimately where creative aging is embraced as a fundamental human right. Dr. Akara joined Lifetime Arts as a deputy director back in 2022 and was involved in many of the organization's initiatives like their annual International Creative Summit and partner with various colleagues from the UK, from Finland, bringing together hundreds of arts and aging leaders from around 25 countries. She came to Lifetime Arts with over 20 years of experience in arts education as well as nonprofit management, including a very important 15 years with the National Guild for Community Arts Education, also a national service organization. And while she was there, it was very important in directing the Guild's large-scale multi-year investment in catalyzing creative aging, as well as creative youth development and their national partnership. Dr. Ikemire has a PhD in theater for youth from Arizona State University, undergraduate degree in English literature from Vassar, and honored to have her with us on the show. A lot of exciting, interesting topics to get into today. Dr. Heather Ikemire, thank you so much for taking time to come on the show.
It's great to be here. Thank you, Ira.
Yeah, awesome to have you, Heather. I look forward to getting into a lot of topics today that we don't normally touch on, but would love to start off, as we typically do, just by handing things to you for a couple minutes to talk more about yourself. You know, I love looking at our guest background work. I noticed that at ASU back in 2010, you know, when you were doing your PhD, that was all on the importance of community arts for youth. Specifically community-based theater and giving the youth ultimately, you know, cultural agency, feeling of responsibility in their communities. Talk a little bit about your background and what got you interested in this theme, obviously starting in sort of the earlier stages of life, and then we'll be getting into creative aging a little later on.
Sure, I'm happy to talk a little bit about that. I guess the first thing I should note is that I grew up in a very creative family. And so for me growing up, the arts wasn't something separate in our lives. It was sort of woven throughout everything we did. So if there was a school project, my mom was an art teacher and a visual artist and an illustrator. And so we were always looking at sort of how can we make whatever task was at hand the most creative. And so that was a sensibility from a very young age. My grandmother grew up on a farm in Kansas and learned how to play the piano at the age of 3, and then ended up finding her way over to New York City and becoming a concert pianist and playing Carnegie Hall. And so this was just sort of in the atmosphere growing up, and really something that I grew up with a sensibility that was a right of every person. And I guess it was later in life that I realized that not everyone had that experience where creativity and access to arts and arts education was a universal. So I had always had a passion for theater and storytelling. I did theater all the way growing up, and really became interested initially in how theater can help us express ourselves, tell our own stories, connect with each other. That led me to doing some work early on in my career in really fostering artist residencies and K through 12 schools, and really developed my sort of passion for arts education advocacy, and eventually got really passionate about the role that theater, and particularly creating original theater, the role that that can have in really helping young people really tap into their voice, their sense of self-identity, and really help to shape culture, so a large part of my work, I got a PhD, as you said, from Arizona State University, was exploring how when young people are coming together to create original theater pieces together, how that really gives them an experience of, rather than what we would call Paulo Freire called the banking method of education, where often we approach education as, we're going to open up the brain and dump a whole bunch of information in there and see if people remember it. How does positioning young people as creatives and original storytellers allow them to create their own sensibilities around the world and their own place in the world, and then shape other people's perceptions of them? So when you then share that work with others, it can have ripple effects in terms of, in particular for youth, how people perceive young people and what they're capable of. We all have really deeply embedded biases and prejudices around age, and that spans across the age span. And my early interest was how that applies to young people. So that led me into that work. I got a PhD, and I came to New York to do a bunch of work with a number of different youth theater organizations in New York, and connected me at that time, as I was wrapping up that research, with a really incredible organization, the National Guild for Community Arts Education. And I was there for about 15 years. And was really running national programs for them. And the National Guild is a national service organization for nonprofit arts education organizations who are community-based and working with populations throughout the lifespan. And while I came to that work sort of with a background in theater for youth and arts education, primarily for focused on young people, I realized that the same principles for arts education, good arts education for young people, which is around really tapping into how do we show up for young people holistically, and what are the ways that the arts can build skills and confidence, social connections, and a sense of cultural agency, apply for arts education for everyone throughout our lifespans. But structurally, we tend to focus on young people for those learning opportunities. And so while I was growing programs nationally throughout the Guild and working with professionals around the country, I became very passionate about advocating for the role of arts in lifelong learning, and particularly for older people, and built a multi-year initiative to support arts educators in a number of community-based settings to focus on older people in addition to youth. And over that time really grew work within that field. I think we saw a 40% increase in nonprofit organizations starting to purposely engage older people in meaningful arts learning experiences just in 3 years. And so that's a little bit about my background.
No, I appreciate that, and again, I was unfamiliar with the Guild. I'd heard about the Guild, but I wasn't really aware of sort of the all-encompassing nature and sense of hundreds of organizations across I think 46 states of the country currently, and one other thing that stood out there, and I'd love if you could just touch on this as we will be getting into lifetime arts and everything going on there, but I believe it was around the 2008-2009 timeframe where the National Guild partners with MetLife to, I guess, do sort of a pilot creative aging program. And I'd love if you could sort of take us back to that period, some of the things that you learned, because I believe that was the first sort of major sort of experiment, I would say, with a major organization like MetLife, thinking about, I know there was, how we improve quality of life with these new techniques, how we raise public awareness and so forth. So could you take us back then as well and tell us a little bit about that program? Because I know you were there at the time.
And actually, before I kind of talk specifically about that program, I can share a little bit about what the impetus was behind
Sure.
that. Because in 2006, there was a seminal research study by Dr. Gene Cohen, who out of Georgetown University, the late Dr. Gene Cohen, who did really the first research, peer-reviewed study of participatory arts learning's effect on older adults, and specifically looking at what health and wellness outcomes result from that kind of programming. So Dr. Gene Cohen had published his Creativity and Aging study, and this was in 2006, and the research was over 3 months. It was looking at a control group and an intervention group of older adults over the age of 55 in 3 cities. So it was San Francisco, it was New York, and Washington, D.C., and there were 50 older adults in each of those research studies. And they were fairly matched in functionality at that time. So there was a control group that went ahead and did their daily activities as normal. And there was an intervention group that participated in hands-on arts learning over several weeks, taught by a professional teaching artist, that was focused on building artistic skills in a number of artistic disciplines over time. So this could be dance, theater, visual arts, etc. With artists who were really intentionally integrating social connection throughout the arts learning experience, right? So rather than just having coffee before and staying for snacks later, really thinking about how do we weave in opportunities for older people to build theater together, to harken back to my earlier experience, or to evaluate a piece of art and discuss a piece of art together, right? Maybe share personal stories, that sort of thing. The researchers really expected some kind of gradual decline in both groups in each study site, but actually found surprisingly that the older adults that were part of the intervention groups made significant gains in their sense of connection, their sense of joy. They were actually taking fewer medications. They were visiting the doctor less. And so this was really the very first study that went deep and looked at the real tangible health and benefits of a participatory arts learning experience for older adults. Also at that time, on the heels of that, the National Guild for Community Arts Education, along with the former National Center for Creative Aging and the New Jersey Performing Arts Center, had just published a toolkit called the Arts and Aging Toolkit, which was actually like a tangible guide, taking that research and distilling it for folks both in the arts sector and the aging sector to figure out, okay, well, how do we actually create these programs? And so the Guild was really at the forefront of getting out that practical guide, which caught the attention of MetLife Foundation. So MetLife Foundation was really interested to think about how could we help nonprofit organizations, in particular, in the case of the Guild, arts education nonprofits who have traditionally focused on educating young people, to expand their view to really serve older people through this model of arts education, which we now call creative aging, and to really understand what those impacts were. So that MetLife Foundation funded initiative through the Guild helped us actually train nonprofit arts educators in a framework for creative aging that really aligned with the findings of Gene Cohen's study. And then support them with seed programs, seed grants to get started. And that program really also helped the Guild then document and share out what was happening in some of these programs around the country, and also what it took to be successful in running a program that had these impacts, these positive impacts for older people.
Mm-hmm. Mm-hmm. You get me thinking of the George Bernard Shaw quote. You know, we don't stop playing because we grow old. We grow old because we stop playing. And what you're pointing out here, you know, beyond physical activity, although obviously dance is very physical, but we need drama, we need music, we need literature, art. And aside, as you were just pointing out, to the improvements to all sort of forms of well-being, it also gives us a way to combat ageism, to combat social isolation, which has been a very hot topic. You know, from the from the Surgeon General on down. Talk a little bit now, if you would, about Lifetime Arts. You know, because all of this sort of fits into the core mission of your organization, which is, as you mentioned at the beginning, a national service organization. And if you could say a couple words as well, you know, from the perspective of where we are we're in 2020, you know, sorry, 2025 now. We talk about sort of the major demographic shifts that are happening, not just in the United States, but globally. And that, yeah, we have aging services. We profile a lot of them, from HHS to ACL to what goes on at NIA and NIH. Talk a little bit about how you look at sort of the current United States aging services system. What falls short? Where do these programs belong in a comprehensive system for healthy aging?
Well, I think I'm going to take that question in two parts, Ira. So I'll tell you a
Please
little
do.
bit about Lifetime Arts and sort of what we do and why we do it, and then really what the need is that this work is meeting. So Lifetime Arts began in also sort of following that Gene Cohen study and the work that was happening across the country around creative aging and the attention that was having. It was founded in 2008.
Mm-hmm.
And it was really founded with a simple but pretty powerful vision, which was to enrich the lives of older adults through creativity. And we now advocate and have been advocating for the role of creativity and creative aging. It's not just a nice to have, as a nice program off to the side, but
Mm-hmm.
something that really should be established as a core component of all older adult programming, services, and care across
Mm-hmm.
sectors.
Mm-hmm.
So simply put, creative aging is an evidence-based practice that engages older adults over the age of 55 in artistic activities that enhance lifelong learning, social connection, and quality of life. And so we believe that having opportunities to exercise creativity, again, is really an essential part of what it means to age with health, to healthy aging.
Mm-hmm.
And the organization was founded because as all this new research and attention was coming out, there really wasn't an infrastructure to train folks nationally and across sectors in the design principles of creative aging that can lead to these really profound health and wellness benefits. Certainly, there's a longstanding practice of creative aging in many forms in this country and in many cultural communities.
Mm-hmm.
But the profession there at the Lifetime Arts is really founded to sort of professionalize this work.
Mm-hmm.
And to connect people across sectors and across communities who are interested in doing this work together, to share
Mm-hmm.
ideas, advice, and to really collectively raise awareness of the benefits. So over the 16 years, we've done this in two core ways. We offer grassroots training. So we work with teaching artists, professional artists, and practicing artists across the country. But we also work with community organizations and government agencies. So community organizations like libraries, veterans homes, museums, art centers, as well as state agencies and local agencies, in really helping them design, deliver, and sustain quality creative aging programs. We also work at the systems level, and a lot of the work at the systems level is really around bringing together partners across sectors and nationally to raise awareness of this work and really embed it into their plans, into their organizations, their budgets, and their policies. And this is the work that we do to help this practice stick, so to speak. So while we work with organizations to help them sustain it in their own right, to get us to the vision where this is really embedded into the fabric of our communities, we realize that we also have to work at the systems level. So we'll often bring together, the Department of Health, Aging Services divisions, state arts agencies, state libraries, for example, into partnerships to support their constituent networks to do this work. We've also worked with, as you've mentioned, we've been key partners with the National Guild for Community Arts Education, been key partners with the American Alliance for Museums and the National Assembly of State Arts Agencies to really lift up the importance of this work, especially at this time. As you mentioned, there are huge demographic shifts underfoot globally and certainly in this country. We have a rising aging population, and this is a really good thing, right? This is due to, in part, falling fertility rates, but also advances in technology and health that are enabling us to live longer lives. And I think many of us have heard the statistic that by the year of 2034, there will be more people over the age of 65 than under the age of 18 for the first time in our history. And that demographic shift is only projected to continue. And I believe the U.S. Census Bureau several years ago were anticipating a 50% increase in the number of older adults in this country between the years of 2016 and 2030. And at Lifetime Arts, we see this as an opportunity, but older adults have incredible experience, strengths, contributions to make in our communities. But frankly, our aging services system traditionally is not prepared. Many of our organizations are not prepared. Our aging services sector is still largely uncoordinated and focused on decline, really then helping to see all that older adults can still contribute and to sort of meeting not just their needs, but their aspirations in life throughout their lifespans. And this is compounded by ageism. And so, even when we say things like, oh, it's the silver tsunami, when we're referring to the rising aging population, this image of mass destruction really emphasizes, that the rising aging population is something to fear rather than something to celebrate, and think about how we are coordinating as organizations and agencies to really meet this moment and make sure everyone thrives as part of a healthy life. Even when we talk about, I think, notions of older adults as all being economically secure, right? This notion of the boomers and how they're robbing young people of opportunity and, also obscures the fact that the experience of aging is not equal. And so while there's rising longevity, I think those stereotypes around older people as they are not in need, right? Or they have access to everything they want really obscures some of the real differences in the aging experience for, different, depending on race, depending on income, even depending on geography. I mean, your zip code actually can determine differences in your longevity. And so we are really trying to reverse the frame, right? So to really, instead of looking at aging as something negative or something to be feared, as something to be as a time of real possibility, a time of growth and a moment in our lives to be celebrated, and really trying to shine a light on the fact that creativity can play a key role in changing the narrative around aging, but also really changing our experience of what it is to age in this country.
Mhm. And core to um, what you do is something known as the Creative Aging Collaborative, also known as the CoLab. And you were just mentioning, many of the different sectors that potentially could tap into this tool, and you mentioned, public libraries and museums and various arts organizations. Talk a little bit how the CoLab works. Obviously, again, I would imagine, teaching a librarian versus a docent at a museum versus, the elder care facility where my mother-in-law is currently. I mean, obviously a similar message, but obviously probably little tweaks along the way. What's CoLab all about? Talk about how that works.
Yeah, well, thanks for asking. CoLab is actually a new program that we're launching this year, and it builds off of our core training course, which is Creative Aging Foundations. So I might just back up and share a little bit more about what the training is about, and then how CoLab really builds on that and is working to create a national network for creative aging. So, Lifetime Arts doesn't we don't hand out curriculum kits. This isn't about teaching people how to do creative aging in one particular way. Dr. Gene Cohen found in his study that there were really, no matter the approach to creative aging, really two core components to any creative aging program that can lead to these profound health and wellness benefits. And the first component is what he called mastery, which is what many gerontologists believe that a key part of healthy aging is a sense of control, a sense that we have a part in our own decision making as we age, right? That we still have a voice, that we still are part of our own decision making. And so what this means in a creative aging class is giving older adults an opportunity to learn a skill, an artistic skill, over time, to practice what they've learned, to reflect on how they're growing, and then to see themselves get better at it. Right. And this taps into, of course, a lot of research on the plasticity of the brain and what we know about lifelong learning, and that we can actually create new neural pathways and really continue to learn as we age. Whereas many years ago, it was believed that those neurons may weaken over time or even diminish. We know now, of course, that we can actually rewire the brain, and that aging can be a real time of learning and growth, and a chance to really reinvent things in our lives. Yep. So mastery is one component. The second component was social engagement. So this is really what I was referring to earlier around really intentionally weaving opportunities for meaningful social engagement and community building. Mm-hmm. In the arts learning process itself, right? So coming back to a class week after week allows us to build relationships, right? Meaningful relationships that often last beyond that class. We've often heard from older adults who participate in creative aging programs that, when they don't show up, people wonder why, right? They want to know where you are. We were expecting you. I think to know that we're missed is a really powerful thing for any of us, right? And to know that people want us there. And so in our core sort of training, what we spend a lot of time on with people, no matter what the sector is how do you design a program with a teaching artist, right, in a community space that integrates these two principles, whether it's a dance class, a theater class, a visual arts class. We've even had, plasma arts and all sorts of things that people do, filmmaking. But those two core principles are really what lead to these really significant health and wellness benefits. Mm-hmm. We also spend a lot of time in that training really addressing what's different about an older adult learner. How does ageism really affect what we think is possible, for people as they age, and even how we set up programs and allocate our budgets, or think about who to partner with. And then really how to create programs that are responsive to older adults' needs. How do you talk to older adults and really ask them, what do you want to learn? What do what are your interests, right? And not assume that. So folks go through this really incredible experience to learn more about creative aging and how to design and deliver those programs. And what we've heard over the 16 years that we've been doing this is folks want to connect with other people, whether that's in their sector or around the country, to share information, ideas with them, and just discuss common challenges of this work as a community of practice. And so this year we are launching for the very first time the Creative Aging Collaborative, which is in short is the CoLab. It's an online community of practice that is open to folks who have experience in creative aging or have gone through one of our training programs or coaching programs, and is really designed as a space where they can continue to learn, but more importantly, to build these lasting relationships with each other as professionals doing this work, to realize opportunities for new projects, to spark innovation. And what we hope over time will be a group that is really mobilized to be a collective voice for advocating for this work in their local communities and their states and nationally as well.
And one of the other interesting things that stood out when I was reading about the work you're doing to help position libraries as these important hubs in the creative aging model. You've set up this really interesting creative aging foundations on demand. And it got me thinking about, because you mentioned lifelong learning at the beginning, and we've on a couple of shows I covered this principle of sort of the school or the university of the so-called third age, and what our elders want to learn. What's sort of the next, with this renewed vitality and well-being, what's the next sort of step in the stuff they want to learn? Any surprises along the way as you deal with, okay, we're doing drama and we're doing art, and we're doing music, but hey. I want to also learn about, I don't know, artificial intelligence or something out of the blue that you might not think of. Any interesting surprises, any untapped sectors that you're like, oh, wow, this is, I didn't think, there would be interest in this, but maybe this should be a target of ours as well.
Yeah, well, again, I think just like us at any age, right? I mean, we have so many interests in older adults. As we age, we still have so many interests, right? And I think sometimes listen, we are all in the aging club. We're all aging, and it's an incredible privilege to age. And we're also all ageist. It's Ashton Applewhite, who is a aging advocate, calls ageism the last socially acceptable prejudice. And she really, underscores that it's not the fact that the number of years of our lives are going up, but it's really the persistent ageism that exists in our culture that makes the experience of aging not what it could be. And I think that sometimes we place our limitations on ourselves around what we think we can learn or do, right? How many times do we hear in our culture, oh, you're too old to be having that haircut, or to be wearing that, or to be doing that? And sometimes those get deeply embedded in our own minds, right? But they also sometimes exist in our institutions, right? Where we say, oh, older adults only want to learn watercolor, which watercolor is great, right? But to your point, we always invite organizations and artists to start with a needs assessment of the community that they want to serve, and literally ask, what is it that you want to learn? And we have found incredibly amazing things. As I mentioned, older adults want to learn how to make films. We've had older adults who've asked to taxidermy art. We've had older adults who have done, as I mentioned earlier, plasma cutting or making leather belts. It really runs the gamut. And it always starts with asking, what is it that you want to learn? What is something that you want to try? And then also connecting them with an artist who then knows that artistic practice and can adapt how they teach it to an older adult learner. So again, we don't hand out curriculum kits. We always honor the desires of the people who want to participate in the class and really lean into the skills and deep experience of the practicing artists that teach these classes and just help them with some of these learning principles around how to design classes that really are adapted for older adult learners and their needs. So yeah, the sky's the limit. And often what older adults want to learn also is responsive to the community that they're part of, the region of the country, their cultural backgrounds. And so there's no limit, I think, to the types of classes that we've seen and that people keep wanting to explore. I think we even had a gnome and fairy house workshop that older adults requested. Sound recording. And I think sometimes we think older adults can't adapt to technology or don't want to learn something. And that's just simply not true.
Right. Fascinating. I want to ask you, what about one other set of projects that's listed on the website, and it's specifically Lifetime Arts project for creative aging in the West. And here is a set of programs across Idaho, Montana, Nevada, Utah, and Wyoming. Again, the sort of the same plan, but one of the things that stood out here was the potential focus not just in cities, but in rural and ultimately tribal communities. And this area of our country is full of dozens of native nations and tribes. It was quite interesting because it was about 2 years ago now. I hosted Larry Curley on the show of the Navajo Nation. He's the executive director of the National Indian Council on Aging, and this is a very important part of what we discussed, in the sense, these are communities and native nations, they're based on dance, music, stories. Would love to any interest. Obviously, talk broadly about the creative aging in the West program, but any interesting stories related specifically to tribal communities. I think that's an overlooked area that we don't normally think as much about, but an important piece in this as well.
Yeah, I think I want to first go back to what I said earlier, which is creative aging is a term for a long-standing practice in many communities, right? So it's a term that, in a sense, was identified to coalesce a field. And I think that it's a great way to sort of point to and identify, right, principles of practice that can lead to great work for older people. I think sometimes there's always a risk when you codify a term that it can erase a lot of work that doesn't call itself that, right? Specifically, that has been part of community for generations. And I think that's certainly true for Indigenous communities and many communities of color and religious communities throughout our country and our world. And so I think it's really important to underscore that, and which is exactly why Lifetime Arts isn't in the business of sort of handing out curriculum kits, but really wanting to lift up the work that's already happening in community, right? Really honoring the expertise of practicing artists who are skilled in their trade, who are skilled in their profession, and helping them sort of better reach older people, right? And so I just want to really emphasize that, because I think it's really important to not kind of go into community bringing sort of a bag of tools when a community already has creativity. Really, communities have creativity and often aren't connected to other people, or maybe thinking about older adults specifically. So that's one point I just want to make. I think that let me just tell you a little bit about the Western states, and then I can circle back to your question around ways in which different cultural communities are being engaged. So the National Assembly of State Arts Agencies, actually with support from EA Michelson Philanthropy, was able to support state arts agencies around the country in really amplifying creative aging throughout their states, through their constituent networks. And EA Michelson Philanthropy was able to provide some seed grants to states to really catalyze programs, train artists, train organizations, do some needs assessment mapping. It was really different for each state, where they wanted to take things. That has been incredibly impactful to have a network of state arts agencies really lift up the power of creative aging and the importance of creative aging in our communities. One of the things that we trained many of those state arts agencies and their constituent networks over the course of that initiative. And one of the things that we heard from them was, this is great. I want to start a grant program to support this, but many of them are working with limited staff and resources. Mm-hmm. And they were looking to think about, well, how do I sustain this? If I want to do more of this, reach communities that aren't, in our metro centers, how do I do this, right? How do I get this to stick in a way that doesn't burn out my entire staff, which in some cases might be one or two people? So we had been talking particularly with 5 states in the West. This is Idaho, Utah, Montana, Nevada, Wyoming, who are significant, rural states, who were really interested. The state arts agencies were interested in reaching older adults who were not in their city centers, who might not have access always to an arts center or a museum. But they may have a library in their community, Right. They have other community spaces where older adults are gathering. Sometimes we call these the third spaces, right? They're not always the senior centers, but they are places where older adults are gathering. And so this initiative, which is called Creativity in the West, we're in the second year of a 3-year initiative, was designed to support these 5 states in building multi-level state partnerships to advance creative aging. And so sometimes that was one partnership, getting the state arts agency to reach out to their state library or their state veteran services department. Sometimes some of those partnerships were already starting to percolate, but needed some support to really deepen those relationships or even expand them. So I think Wyoming is a great example where the State Arts Agency had done some work initially with the Wyoming Community Foundation, supported by Smith Charitable Trust, to get some programs started. And the success of that program, we did an evaluation report of that program, enabled them to form a relationship with the Department of Health Aging Services Division in Wyoming, which now funds some creative aging work in the state. And now they're actually part of a multi-year advancing library leadership in creative aging project with us as well. So the project is first and foremost really focused on the importance of building these multi-sector partnerships to support creative aging. Again, focusing on that this is not just a program that's a nice to have, but something that really is a practice that should be woven throughout all older adult programming, services, and care. It's also focused on building capacity and a workforce of artists across those states to be able to deliver quality creative aging programming, and then to document the impact of those programs and disseminate what's really happening so that more partners can come on board and there's an opportunity to leverage more investment. And so what we've seen in those states is some really profound partnerships where Montana's in a great example where they specifically wanted to train up a teaching artist workforce of practicing artists in the most rural areas of their states. Many of these artists weren't necessarily didn't have degrees necessarily from colleges and universities and how to teach their art form, but they were incredible folk artists, practicing artists in community who needed some support in sort of how do you adapt your trade or your artistic practice for older adults. And then we partnered those artists with libraries and other community-based organizations in the state to reach older adults who maybe because of geography and a variety of other reasons couldn't get to regular arts programming that you might find in a metropolitan area. I think that part of that grant is also deeply focused on listening. So they're in those states, particularly with there's a real process of just building relationship with tribal communities, right? Sometimes our government agencies and our tribal communities aren't talking, right? And so how do we that's a long-term process of building trust-based relationships and really finding out what communities already have, don't want, and ways that those state agencies can meaningfully support those communities in doing this work.
Heather, one of the my mother, who almost made it to 90, always attributed her law. It wasn't her medicines. It wasn't healthy eating. It wasn't even me. it was my kids, right? And keep my three kids, her grandkids, gave her new meaning and purpose to hang around. And we've talked about the theme of intergenerationality on the show. I've gone into the Creative Aging portal, and you profile things that are going on in terms of designing best practices for intergenerational arts programs, organizations like Generations United and so forth that we've had on the show. Talk a little bit about intergenerational arts programs and a little bit of what's happening there, because I think that's, again, it sort of feeds back to your PhD work in a sense, but what are we learning in terms of not just the importance of creative arts, but creative intergenerational arts?
Yeah, that's a great question. I think the ultimate vision is communities that are just brimming with intergenerational connection, right? That's the ultimate aim, right? We have the structures of our society, whether it's schooling or the way that, we're set up to go to school, then work, then retire, and often put us in silos that are artificial. And so I just want to say that the ultimate vision is, in my view, is a world that is brimming with intergenerational connection and exchange, as well as opportunities, right, to gather with your peers, right? There, of course, there's benefit in gathering in affinity groups, whether that's by age or however, but I also think, going back to my earlier comment, I think many of the incredible principles of just good arts learning around really showing up for the whole person, not just coming in for a 30-minute piano lesson and then leaving, but how are we using the arts to support people in making meaningful connection, finding their voice, reflecting on their identity, and realizing that they can contribute at any age, are true from the time we're young all the way to the time that we're older, right? I am a staunch advocate for the role of arts learning in individual human development and what makes our communities vibrant and vital. And so I think that's true across the lifespan. I think often what can happen in intergenerational arts programming is that I think what we typically see in an intergenerational program is an older person coming in to bestow their wisdom for a younger person, right? And there are some beautiful things about that, right? Around sort of sharing memories, sharing skills, and that's important. But often in those programs, there aren't equal opportunities for older people to actually also be learning, right? For them to also be creating and to be positioned as someone who's a maker, as well as someone who has something to give. And so I think when thinking about intergenerational programming, it's really important to create spaces where safe spaces where younger people and older people can explore some of their preconceived notions of what it means to be young or to be old, for those programs to be carefully facilitated so that we can undo some of those sort of ingrained prejudices or biases that we all hold about, people of different ages. And then just like a creative aging program, to create opportunities for really intentional community making and community building and relationship building and co-learning and co-making. The other thing I want to stress about intergenerational programming is sometimes there's this preconceived notion that it's the very young and the very old. But when we talk about older adults, we're talking about people ages 55 and up. And so think about all the many generations, even within the older adult population, who have had vastly different experiences, right? In terms of when they were born and when, they grew up. And so there's really also incredible opportunities for us to be thinking about multi-generational programming all along the lifespan. So it's important work. It takes I think a level of care and intentionality to do well. But I think ultimately that's the vision that we seek, is that we are no longer siloed by age, but have opportunities to learn from each other, share with each other, and create together all across the lifespan.
Indeed. So United Nations declared the Decade of Healthy Aging, 2021 to 2030. World Health Organization has their Healthy Aging Collaborative. You mentioned this important milestone coming up with 2034. Would love to sort of look now over the horizon and sort of where society is headed, where you would like to see this going. I know you mentioned the E.A. Michelson Philanthropy, and I did have Teresa Bonner on last year. Wonderful organization. Where would you like to see this all going? What does the future look like if all of a sudden Living Arts had $500 million in your coffers, or whatever, 10 billion, whatever the number may be? What does the horizon look like for you? What would you like to see in terms of this integrative future of healthy aging that has creative arts at its core?
Yeah. So, I think going back to the vision, we want a world without social isolation, without ageism, and where creative aging is woven into the fabric of community, where it's really a core part of any older adult programming, services, and care across sectors, right? Not something that is a program off to the side that's nice to have, but something that is embedded, right? I think woven into all of our community-based organizations, our plans for aging, and ultimately where we have a culture shift, right? That realizes the experience of aging as one not of drain on society, not one of just focused on decline, but that aging is really can be a period of incredible growth and learning and contribution at every age. So that's the vision. I think there's some really exciting opportunities afoot. First of all, I would say personally, for us as individuals, again, nobody's escaping the aging club. We're all aging. It is a privilege to age. And I think just personally, I hope that, this isn't an issue that just affects those of us who are really nearing 55 or over 55, right? I think we all need to sit with the question of, how do you want to age? Do you want to age in abundance with opportunities to thrive where, thriving and having opportunities to fulfill all your aspirations are a given? Right? That those opportunities are fully supported. And whether you are in assisted living or aging at home, that you have those opportunities and you can afford them and you can take advantage of them. Or do you want that experience of aging to be one of those opportunities being stripped away, right? I think most of us would say the former, and that's what we want for our loved ones as well. I think that beyond sort of our individual commitment to the future, there's some really incredible opportunities afoot for us to establish creative aging in, opportunities for healthy aging policy and plans. So one of the things that is really incredible is I think nearly half of the states in this country are at some point in a process of developing a multi-sector plan for aging.
Right.
And these plans are usually, authorized by a governor and then led by a task force. Often they're sort of managed by the state Department of Health or Aging, however. But the intent of that process is really one of collective action, right? The notion that, sort of showing up and bolstering our aging services doesn't rest as a responsibility of just the Department of Aging or Department of Health, but requires the Department of Transportation. It requires the Department of Veterans Affairs. It requires, right, we as, if you're working in the public sector, we're mandated to serve all constituents, including older adults. And I think the opportunity there is often we forget that the state arts agency or the state library, right, that our cultural institutions are part and should be part and seen as part of the aging services sector. Our arts and cultural organizations are third spaces, community hubs in our communities where older adults already show up to learn. They already go to the library to receive services or go to their local museum. And so how can these spaces in our community be positioned as thriving, spaces for older people and be at the table when these plans at the state level are being crafted, so that creativity is kind of woven into the vision of aging in our future. Similarly, that just this past year, a strategic framework for a national plan for aging was drafted. And so that's another opportunity on the horizon where, multiple federal agencies are coming together to imagine how we can better serve communities as they age, right? And so I think we have an opportunity to think about where do the arts and where does creativity fit within those plans for healthy aging and for livable communities and making services more available. I know Time Slips, which is an organization that focuses on the role of creative engagement for people with dementia and their caregivers, did an incredible program for many years where they partnered with Meals on Wheels and helped those who were delivering food to people in their homes in that moment of exchange to embed a creative moment, a beautiful question that they ask, a moment of social engagement. So how can we, even in small ways,
Right.
start to weave creativity into the ways that we show up for older people? And then lastly, I'll just say I'm really energized by some of the attention that's being given to the possibility of social prescribing for the arts in this country.
Okay.
If you're not familiar, social prescribing is a practice that is common in Europe, particularly in England and some other areas, where a doctor, a medical practitioner, can actually prescribe a
Mm.
dose of arts and culture to a patient, really grounded in such, the incredible research that we have already that points to the important role of arts as a social determinant of health. And so there's a phenomenal cohort of professionals in this country who are really trying to examine what would that look like in this country, right?
Right.
Certainly the way that the medical and insurance system is set up here is different than in the UK. But the World Health Organization did a sort of summary of research, and there are just thousands and thousands of research studies worldwide that underscore the critical role of arts in health. And the one study I'm referring to is led by Daisy Fancourt and her team. And then there are, of course, studies like the one I named with Jean Cohen that point to particular practices. But Dr. Tasha Golden out of Johns Hopkins University published a report called Arts on Prescription,
Okay.
which documents several of the pilot studies in our country that are looking at small pilots of prescribing anything from a visit to your local arts museum to a full-blown creative aging program, and how that works, how that can work in community. And then there's another organization called Art Pharmacy, which is honestly building a tech platform that connects doctors to individual members who sign up. When your doctor signs a prescription, you're connected to sort of what in the UK they're called a link worker that then meets with you as patient and says, great, your doctor has prescribed you X amount of doses of arts and culture, and here's some opportunities in your community, and connects you to those communities. They then track, what was your experience? Did you feel an improved sense of mood? Did you feel more connected? And then they're sort of beginning to aggregate some of that data in mass to see over time what benefits are these sort of social prescriptions for the arts having on individuals. And what health payers really care about are the numbers. So if we can really get some data en masse to show that this practice is working, I'm really hopeful that this could be an opportunity for more people to engage with the arts across their lifespans, and also for artists and arts and cultural organizations to find a way to sustain it financially.
Mm.
So there's a lot underfoot, which is very exciting, and will be interesting to track.
Yeah, I was completely unaware of this principle of social prescribing. We have something nearby here in Philly known as a food pharmacy where doctors can prescribe healthy food, especially in areas where we have these so-called food deserts in the region. But I was this is fascinating. I'll have to spend more time, maybe
very
do a show
similar.
on art prescribing. Yeah. It's
Yes, the Mass Cultural Council is spearheading several pilots in Massachusetts through Art Pharmacy as well, which I believe you can read online. So
I'll probably do a follow-up show on this. This is
yeah,
this is really
great.
cool. Again, thank you for highlighting that. Um,
Yeah.
Yeah, no, it really, really awesome, Heather. Just I guess one last thing while we have you today, for people that are listening, we profiled folks in academia and industry and government on this show. What would you suggest for listeners that have? I'm inspired listening to you, but for our listeners that are inspired to get involved, whether they have money, whether they're educators, whether they're just interested in being advocates, what next steps can they take to liaise with you, be part of the creative aging movement, and final messages for us while we have you today. If I missed
Yeah.
anything important, I know we've had you for a while, and I was taking all your time, but I really enjoyed the discussion. Final wrap up messages while we have you. Anything that I missed?
Sure, absolutely. Well, first of all, there are some incredible resources online if people are interested in learning more about creative aging, or even watching some videos of programs and hearing. I mean, I think the best thing to do is have the opportunity to see some of this programming in action and to hear from older adults themselves around their experience. So a couple of things I just want to share is certainly on Lifetime Arts website, and that's lifetimearts.org. People can learn more about what is creative aging. They can find resources around the health and wellness benefits of the practice. We have something called the Creative Aging Resource online, which is a free compendium of case stories, research articles, tools, and templates that people can explore. And as part of that, we have a asynchronous online course called Creative Aging on Demand, where people can actually, dig in deep and really learn, how do I find a teaching artist in my community? How do I start to host a program like this? If I want to offer a program online, what does that look like, right? So some of those real nuts and bolts. So that's at lifetimearts.org.
Mm-hmm.
We mentioned E.A. Michelson Philanthropy, who has been an incredible advocate of this work and a supporter of this work across museums, arts and cultural organizations, libraries, et cetera. And they have a wonderful compendium of videos called Videos to Inspire. People can log on and check out that compendium of really beautiful videos. That's at eamichelsonphilanthropy.org/videos. One of my favorites is something called The Dose of Creativity, which is this beautiful video of older adults in a senior living community that is actually designed. All the programming infuses arts, learning, and creativity. And there's this incredible clips of folks doing theater and dance and just testimonials of older adults around sort of how it's improved their sense of joy and connection and even helped prevent them from falling and so some beautiful things. But also on that website is a real recent video where that E.A. Michelson Philanthropy produced that highlights Jane Fonda talking about the power of creativity, which was recently aired on CBS Sunday Morning. So check that out. Just wonderful videos that I think give a beautiful sense of what this work can look like in practice. So you don't have to reinvent the wheel. There are resources online. If folks are interested in learning more and going deeper, please reach out through lifetimearts.org to connect with us around training, coaching opportunities, even partnership opportunities at the state and local level. We are really happy to work with folks from all sectors, organizations, small and large, as well as individual teaching artists. So lots of opportunities online. I think beyond that, I always, at a hyper local level, I always encourage folks to, if you don't already know the older adult services in your area, go and pay a visit to your local senior center. Find out if there's a memory cafe, which are these beautiful programs in coffee houses and libraries that are set up for people with dementia and their caregivers that are really integrating arts learning as a core component of just supporting people with dementia. Maybe there's a memory cafe at your local library. Go and pay a visit. spend some time asking older adults what it is they want, and then thinking about, maybe if you're at an organization or a local agency, what, how can you build on the strengths and assets you already have to play a part in this work. Maybe it's offering your space up for a program to happen. Maybe you have some resources that you can share that connects a local artist or a local arts organization to a group of older adults who could really benefit in this programming. So I always start with the personal. Think about who's in your community. Spend time really knowing what's already available in your community and where you can fill a gap. And then if you're able, in a position to play a larger advocacy role, some of these opportunities, as I've mentioned, for thinking about how we advocate for arts and culture, to be at the table where some of these state plans for aging are developing, or even as things advance at the national level, think about really just uplift the arts and culture as a key player in the aging services sector, I think is ultimately important. Beyond that, like I said, there's good work happening underfoot. Lifetime Arts has trained more than 10,000 individuals and organizations in creative aging. We've seen a 133% increase in the number of creative aging programs through our own work to develop partnerships across the country. But there is a need for continued research around the various approaches and for funding in this work. And so if folks are in a position where they can support this work at the local, state, or national level, or are interested in supporting more knowledge development and research around the benefits of arts learning, particularly for older adults, there's a need. And we'd love to talk with you. And I think ultimately, I hope that we can all move from thinking about the arts as something that is only reserved for a few, or something that is nice to have, and that over time we're able to really think about it as something that is just a part of what it is to live, just as we drink water, we breathe air, and we know that we need to get our daily exercise and wear our seatbelt. This is our seatbelt moment. We have an opportunity to really shift perceptions of what it means to age, and to build a future where aging is seen as a real time of opportunity and growth.
An amazing set of programs. It's been really interesting listening to what you've built over the years, and your visions for how this could all play out in the future, and just wishing you, Heather, and your team the best with all of it as you continue to move these programs forward in 2025 and beyond. Really inspiring. Again, for everybody out there that is going to be listening to this episode of our show across the podcast networks, or who'll be watching on the YouTube channel, you've been spending time with Dr. Heather Ikemire, Executive Director, Lifetime Arts, doing really amazing things to establish creative aging as this essential driver of adult health, of well-being, embraces a fundamental human right, and ultimately help eliminate ageism and social isolation from our world. Heather, again, I want to thank you for taking the time out of your schedule to come talk to us, to educate us for a while on all these topics. Thank you for everything you do there at Lifetime Arts. And as we like to say on our show, thanks for creating a better tomorrow for millions of people out there via what you're putting together. Really an awesome story.
Thank you for having me.